To order. Katie, please call roll.
Mr. Mark Popian,
Present.
Dr. Meta,
Present.
Ms. Rosenberg, Mr. Terry, Ms. Williams,
Oh, she's
Cheryl?
muted. Is she muted?
You're muted, Cheryl.
This is the moderator. Give us just a moment, please. All right, it looks like you're good to go. Cheryl, are you with us? This is David, the moderator. Cheryl, can you hear me? I show you're unmuted.
No, let's try now. Mm. Okay, we'll just move on. Vice President Hernandez
Present.
and President Guzman.
Present. Thank you. A quorum is present. Item number 1, President's opening remarks. I want to ask everyone to please turn your cell phones to silent. This is an official business meeting of the Respiratory Care Board. You may notice board members accessing their laptops, phones, or other devices during the meeting. They're using the devices solely to access the board meeting materials that are in electronic format. Public comment will be allowed on each agenda item as each item is taken up by the board during the meeting. Under the Open Meetings Act, the board may not take any action on items raised by public comment that are not on the agenda, other than to decide whether to schedule the item for a future meeting. If you would like to provide comment, it would be appreciated, although not required, if you would provide your name and the organization you represent, if applicable, prior to speaking. To allow the board sufficient time to conduct its scheduled business, public comment may be limited. The board welcomes public comment on any item on the agenda, and it is the board's intent to ask for public comment prior to the board taking action on any agenda item. If for some reason I forget to ask for public comment on an agenda item and you wish to speak on the item, please let the moderator know and you will be recognized. If you are an RCP and you would like to earn C credit for your in-person attendance at our meeting today, please be sure to have signed in and also sign out before leaving. If you have any questions, one of our staff members can help you. For those attending virtually via WebEx, please ensure you provided your first and last name as it appears on your license when logging in. Your arrival and departure times will be verified via the WebEx attendance report following the meeting. Verification of CE hours awarded will be emailed to all attendees within 30 days. I would like to acknowledge the recent reappointment of Cheryl Williams by Governor Newsom as a public member of the board. Cheryl can always be counted upon to bring a thoughtful perspective to our meetings and consistently provides invaluable input on many issues. We are very glad she will be sticking around for a few more years. We also have a farewell statement for Sam. This week we received word that Sam Kabush's time on the board has come to an end with the expiration of his second term. On behalf of the board, I want to express our deep gratitude to Sam for his 8 years of service as a public member. His commitment to the mission of protecting consumers and supporting the respiratory care profession has been exemplary. While we will miss Sam's presence on the board, we wish him continued success in his future endeavors. Staff will work to provide Sam with a token of appreciation from the board for his years of service. Having completed my opening remarks, are there any comments or questions from members? All right, seeing none, is there anyone in the audience that would like to make a public comment? Moderator, is there anyone wants to make a comment online?
We are open for public comment on the president's remarks. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users, dial *3 to raise your hand. And for our mobile device users, you may need to hit the ellipses button. That's the ... in order to find your hand. People will be given 3 minutes to speak, and I'll give you a 30-second warning before your time expires. We're going to take just a few more seconds now to see if we have a request for public comment. Seeing no request for public comment, do you wish to continue with the agenda?
Yes, thank you, moderator. Moving on to agenda item 2. This is the March 13, 2025 meeting minutes approval. Members, do you have any additions or corrections to the minutes? Seeing none, may I have a motion to approve the March 13, 2025 meeting minutes as submitted?
Motion.
Would anyone like to make a public comment? Moderator?
We are open for public comment via WebEx on the meeting minutes. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users, dial *3 to raise your hand. We will call on people in the order we have requests. We're going to take just a few seconds now to see if we have a request for public comment. Seeing no request, do you wish to continue with the motion?
Yes, thank you. Hearing none, no comments. Katie, would you please perform the roll call vote?
Sorry,
Oh,
President Guzman.
yes.
just a moment. We want to confirm that that Cheryl can hear.
Yes.
Oh.
I can hear.
Thank you.
Mr. Magpapian,
Yes.
Dr. Mehta,
Yes.
Ms. Rosenberg,
Yes.
Mr. Terry,
Yes.
Ms. Williams,
Yes.
Vice President Hernandez,
Yes.
and President Guzman.
Yes. Thank you, Katie. Moving on to item number 3, Executive Officer's Report. I will now turn it over to Christine for the Executive Officer's Report.
The first item of my report has to do with the governor's executive order requiring a 4-day return to office for staff. At the onset of the COVID pandemic, most staff transitioned to telework in some capacity. During the early stages of the pandemic, telework became the primary work arrangement. Though by 2024, staff had returned to working in the office 2 to 3 days per week. On March 3rd of this year, the governor issued an executive order mandating that all state agencies and departments under his authority implement a hybrid telework policy requiring employees to work from a state office location at least 4 days a week beginning July the 1st. The policy aims to enhance collaboration, communication, and accountability within the state workforce. In alignment with the executive order, beginning July the 1st, all staff will work in the office 4 days per week, with 1 telework day scheduled based on operational needs. While staff demonstrated exceptional adaptability in transitioning to telework, they remained engaged and informed throughout and continued to meet performance measure targets. There is undeniable value in in-person interaction. Many staff members have expressed a sense of nostalgia for the days when we saw each other daily. Despite challenges such as increased commuting costs and traffic, the team has shown overwhelming support for this change. They really do make leading them very easy. And the next item is exclusive online initial application filing beginning in 2026. As part of our ongoing efforts to streamline and modernize processes, we will be transitioning to an exclusively online initial application filing process beginning next year. On April 15th, all program directors were notified that effective January 1, 2026, all initial applications must be submitted through the Breeze online platform, and paper applications will no longer be accepted. This change is aimed at ensuring greater efficiency, reducing processing times, and enhancing the overall experience for applicants and program directors. Additionally, we are updating the process for obtaining a live scan form, which contains the board's pre-populated information for background processing. Soon, live scan forms will only be generated once applicants have successfully filed their initial applications, so the transition to e-filing supports this procedural change as well. Over the last few weeks, I and several other staff members had the opportunity to shadow respiratory therapists at UC Davis Medical Center here in Sacramento. From a personal perspective, shadowing in an ICU was an eye-opening experience. I participated in high-level tours before where I was shown briefly the various settings in which RCPs work. However, this recent visit gave me a front row seat to the critical role RCPs play in patient care. I witnessed the high-pressure environment of the ICU, where quick thinking, precision, and teamwork are absolutely essential. During my time at UC Davis, I observed the intricacies of managing ventilators, assessing respiratory conditions, and collaborating with the multidisciplinary medical team. I gained a deeper understanding of the challenges faced by patients with severe respiratory issues and the technical expertise required to support them. The experience also brought to light the emotional and human aspects of healthcare. I saw how therapists navigate the delicate balance between offering life-saving interventions and providing compassionate care. It was both humbling and inspiring, and I want to express my gratitude to all 4 of you RCPs on this board for the care you have personally provided to California's respiratory care patients. I'd also like to publicly thank Chris Gianelli, the exceptional RCP that allowed me to tag along with him on his ship, despite being maybe just a little suspicious as to why I was there. An update regarding the law and professional ethics revisions. We continue to work with CSRC and AARC on the required revisions to the law and professional ethics course scheduled for implementation next January. The CSRC met the May 1st target date by submitting a draft course, which has already been reviewed by staff and the Professional Qualifications Committee, and feedback has been shared with CSRC. Due to recent staffing changes, AARC has requested additional time, so we have not yet received their course. The final submissions from both organizations are due by September the 26th to ensure staff has adequate time to prepare materials for the board's review and approval at the October 10th meeting. And finally, sunset timeline. So we included a sunset review process timeline that I thought might be helpful because I feel like we always talk about sunset, and the importance of it. And this kind of paints a picture of why it is a 2-year process and kind of, well, just that, the timeline that goes along with it. As many of you know, the sunset review process occurs every 4 years and provides an opportunity for the department, the legislature, the board, and various stakeholders to assess the board's performance and recommend improvements. Our board is included in the next group scheduled for review. As outlined in the attached timeline, the sunset review process typically begins in the spring of each cycle and continues through the end of the following year. Around this time of year, the Joint Sunset Committee provides a template requesting detailed information and data from the boards. We anticipate receiving ours any day, really. Using this template, I will draft the board's report for review, discussion, and approval in the fall, ensuring it's ready for submission by the deadline in either December or January. Then in January or February of 2026, the board sunset bill will be introduced, usually with placeholder language, and hearings commence in February or March. About 10 days before the hearing, the Joint Oversight Committee issues a background paper that evaluates the board's performance since its last review and highlights issues requiring attention. At the hearing, the executive committee and the executive officer testify, and the board has 30 days to submit written responses to the background paper and any additional information requested as part of the hearings. If no significant issues are identified, the legislature typically extends the board's sunset date for another 4 years. The content and data requested in the sunset template have remained largely consistent for about a decade, with only minor revisions or additions. Given this continuity, I have already begun drafting portions of the report using last year's template, as well as current updates to issues that were identified as part of our last sunset review and were required to provide updates. In the coming months, I will continue to develop the report and provide updated drafts to the executive committee for review and feedback before presenting the final draft to the full board at our October meeting. So I don't know if anyone has any questions. Sorry, that was a lot of information.
That was great. Thank you, Christine. Members, any comments or questions? Any public comments from those physically here? Moderator.
We are open for public comment via WebEx on the Executive Officer's report. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand. We will call on people in the order we have requests. We're going to take a few seconds to see if we have a request for public comment. Seeing no request for public comment, do you wish to continue with the agenda?
Yes, thank you. Moving on to item number 4, 2025 legislation of interest. This is also Christine.
Your agenda materials include updates regarding those bills for which the board took watch positions at the March 13th meeting. I wanted to highlight a few of the bills that have had significant amendments since March. AB 667, entitled Professions and Vocations Licensing Exams Interpreters, initially proposed that beginning January 1 of 26, each licensing board within the Department of Consumer Affairs permit applicants who are unable to read, speak, or write in English to use an interpreter during licensing examinations. However, as of April, the bill was amended to exclude healthcare licensure boards. Consequently, the legislation no longer affects our board. AB 742 addresses expedited licensure processing for applicants who are descendants of slaves. The bill mandates that state licensing boards within consumer affairs prioritize licensure applicants who are descendants of slaves. The board previously opposed an earlier version of this legislation last year due to cost impacts associated with certifying that applicants meet the established criteria. However, in April, this bill was amended to assign the responsibility for certifying eligibility to the Bureau for Descendants of American Slavery, which is proposed to be established under a separate bill, SB 518. This amendment effectively eliminates any cost concerns for the board. Finally, SB 389, having to do with LVNs and the suctioning in the school setting. This bill clarifies that a licensed vocational nurse performing suctioning and other basic respiratory tasks under the supervision of a credentialed nurse is not prohibited by the Respiratory Care Practice Act. Initially, the bill proposed amending the education code to allow LVNs to perform suctioning. However, following discussions with the Senate Business and Professions Committee, it was determined that the issue would be better addressed by amending Business and Professions Code Section 3765 within our own Practice Act, where the other exemptions related to LVNs are currently provided. The current version of the bill reflects this change, exempting LVNs from respiratory care licensure requirements for suctioning when performed in a school setting under the supervision of a credentialed school nurse. And there was agreement from both the author and the sponsor, so that amendment was made. And then finally, we have HR 783, the Sustainable Cardiopulmonary Rehab Services in the Home Act. This is a federal bipartisan legislative effort aimed at permanently expanding Medicare coverage for in-home cardiac and pulmonary rehab services delivered via telehealth. This initiative builds upon temporary flexibilities introduced during COVID, which allowed patients to receive these essential services remotely. During the pandemic, temporary waivers demonstrated the effectiveness of home-based rehab services, leading to improved patient outcomes and increased access to care. Recognizing these benefits, the Act aims to make such services a permanent fixture in Medicare. It has garnered support from various healthcare organizations, including the American Association for Cardiovascular and Pulmonary Rehabilitation, the American College of Cardiology, and the American Thoracic Society. We became aware of this bill after the March meeting. Consequently, the executive committee was asked to take an interim support position as permitted to enable the preparation of a support letter, which is included in your materials. The board is now being asked to ratify the interim support position.
Thank you, Christine. So with regard to HR 783, the Sustainable Cardiopulmonary Rehabilitation Services in the Home Act, can I get a motion to ratify the interim support position taken by the Executive Committee on this bill?
I would move that, Michael Terry.
Thank you, Michael. Thank you, Abby. Any member discussion regarding this item?
Yes.
Seeing none, any public comments on those that are here on this item? Moderator?
We are open for public comment on agenda item 4 and the motion for HR 783. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand. And it looks like our first request is coming from Michael Madison. Hold on just a moment, please. We're going to send you a request to unmute your microphone. You'll be given 3 minutes to speak, and I'll give you a 30-second warning before your time expires.
Thank you. Can you hear me okay?
Yes, go ahead,
Yes.
please.
Okay, yeah, just a quick one. The corresponding Senate bill has been entered into the U.S. Senate, and that is S1406.
Mike, can you repeat that?
Yeah, the SOAR Act has been submitted in the Senate by Senator Cassidy, who is a physician in Louisiana. And the reference number, the Senate reference number is S as in Sam, 1406.
Thank you, Michael.
Okay, thank you.
And that was our only request for public comment on this item.
Excellent. Thank you, moderator. Katie, please call the roll call vote.
Mr. Magpapian,
Yes.
Dr. Mehta,
Yes.
Ms. Rosenberg,
Yes.
Mr. Terry,
Yes.
Ms. Williams,
Yes.
Vice President Hernandez,
Aye.
and President Guzman.
Yes. Thank you, Katie. Moving on to item number 5. This is our Professional Qualifications Committee update and discussion. It will be provided by Vice President Hernandez and Michael Terry.
Thank you, President Guzman. So you'll see in the packet for the board book, we have agenda item number 5. And Katie, I don't know who's running is anybody able to actually display the agenda item as I'm talking? On WebEx, just so people can follow along for those who are out there. If not, I'll refer to the page number, but if we can, that'd be awesome.
This is the moderator. What we have displayed on the screen right now is all that's available on WebEx. If someone wants to share their screen, that is a possibility, but other than that.
Got it. So technically, if you're able to. Okay, sounds great. So you'll see in the agenda item, this item here is really making a draft recommendation. But before we get into that draft recommendation, Michael Terry and I, and with support from the executive office, we looked at all the data that we have acquired thus far. And a couple of comments to make on that is in the summary report at the beginning on page 1, you'll see that we've started this process in June of 2021. So now we are finishing 4 years of this really thoughtful and deliberative process. So that's just one statement I want to make, that as we get to this draft recommendation, it isn't all of a sudden. 4 years of work, having meetings, having discussions, bringing the information to our quarterly meetings, getting feedback, taking that feedback, incorporating it at each iteration. So at this point in time, we want to make a draft recommendation as we move forward. So as a reminder, we've done a series of board sessions. We've done some studies ourselves. We looked at experts in the arena and legislators. We polled the respiratory care practitioners, we polled the educators to receive information. And then at our last meeting in February, was that our last meeting? March. We held it in conjunction with the CSRC convention, and so we received some new information, and that's what I'd like to focus on very quickly. So if we can go to page 10 of the agenda item, and you'll see heading the beginning of the page of March 2025, I have a summary of some of the salient points of 3 letters that were submitted. One was from the CSRC via a general survey that they conducted amongst managers. One was done as the UC Collaborative, which is a large employer across the state of respiratory care practitioners. And one was done in conjunction with the CSRC polling educators. And so in those pieces, you can see with each one of these, I've highlighted certain aspects, certainly that have been in support of a movement forward of increasing educational requirements. So taking all of that, they presented to the board. There was spirited conversation and overwhelming positive response of those letters. And as we look at that, one of the things that we did is there's so much information in the last 4 years that the executive office created a separate web page. And that link is on the front of our agenda item, and it can be found on the Respiratory Care Board's web page that has all of this information. And of course, we did add these 3 letters as well to our packet. So if you do have the packet and you haven't looked at those letters, you can read fully through the letters. But as I said, I gathered the salient points there. Okay. At the bottom of the summary on page 10, another new piece of information that we didn't have a chance to talk about. I was prepared to talk at the last meeting, but we had such a great discussion that I didn't get a chance to present it, but I do want to summarize this information right now. And so as we're looking across the country, earlier on, we talked about the AARC and CSRC, our professional organizations, really doing a lot of work over the last 10 years in terms of where our profession is moving. And of course, we looked at their position statements about increasing the minimum qualifications to a bachelor's degree. And we're looking across the country, and we can already see that New York has actually proposed legislation. And again, this link is available on the Respiratory Care Board's website, but they actually have a Senate Bill 6329 working towards moving towards a minimum of a bachelor's degree. So we already have one state that's moving forward. North Carolina, they're focusing right now on the advanced respiratory care practitioner, and Michael Terry's going to give us an update in terms of at least that pathway. We do know in discussions from across the country that there are about 3 other states that are either in a discovery phase or in an actual discussion via their boards or their mechanisms in terms of a bachelor's degree. So we're starting to see a movement across the nation in terms of all the work that's been done that's really over a decade old from its inception with the AARC, okay? And so those are really the 2 new pieces of information. In a timely fashion, in a strategic fashion, certainly, as Christine talked about, the Sunset Review is now starting its process. So 4 years of thoughtful, deliberative work and conversation via the board. It's time after 4 years to now present a statement for the board to consider, okay? And so if we go to page 11 of the report, the draft licensure recommendation for discussion. And again, looking at all the data, all the conversations that have taken place, one of the main salient points is the profession of respiratory care has advanced. We are 50, 60 years old now, I think. Licensure began in 1986 for the state of California. Is that right, Christine? 1985. 85. So we are now 85, 95, 105, 40 years. And the last report that just came out from the Respiratory Care Board, you recognized all the people that had initial licensure. So 40 years now, our profession has advanced very quickly in a short period of time. We also do know that there is a shortage of physicians and specialty physicians, pulmonologists, and respiratory care practitioners already being asked to take on that gap. So we've really moved from a technical aspect as a respiratory care practitioner now to really a practitioner and really having to hold a lot of responsibility. So all to say, you've been able to look at the bullet points and read the bullet points, but that's really the encapsulation of why now it's really time for our Professional Qualifications Committee to present a draft recommendation. So if we look at the last page, page 12, you'll see that the recommendation is very short and general. And strategically, we think that's a good idea right now because this is the first time now we're presenting a stance. And now to have discussion so that as we move forward and as the sunset review process starts, we can show that we've done work and we're making progress, whatever that progress is, okay? So based on data gathered in in-depth discussions over the past 4 years now, the Professional Qualifications Committee recommends educational licensure requirements for entry into practice be increased to a bachelor's degree minimum. The increased educational requirements support improvement in health, safety, and welfare of California citizens in need of respiratory care services and aligns with current and evolving healthcare practices. And before I end this report, I want to go back to the summary and just highlight a couple of things that might be helpful for our discussion and certainly the feedback from the community out there. So one, we always have to remind folks that should something be changed and enacted, who would be meeting those requirements? And anybody who has licensure now still will hold licensure. And as long as they keep their licensure up, they can continue to practice. So it doesn't legislate anybody out of a job, doesn't require them to meet new standards. However, we always encourage people to meet new standards so the profession as a whole comes up. So that's number one. Number two, as soon as there's discussion to start a change, then we get people having lots of questions. So I want to go back to now page 5 of the agenda board book item. And you can see in March 2023, we did a series of focus groups, and then we identified some recommendations. And I think it's important for us to remember in terms of these recommendations, things that have been carried out by the board to this point and things that still have to be done, okay? And so we identified and conducted follow-up strategies and surveys. We did those things after March 2023. And then the other green bulleted item was we promoted an increase in the number of bachelor degree programs across the state. And as a reminder, the California legislature supported and approved community colleges to offer baccalaureate degrees in certain career-focused areas. And respiratory care has taken on that challenge. And again, we have 19 community college associate degree granting respiratory care programs. And of those 19, as of last report, last March, we had 10. And I think since then we add one more, Napa Valley College. So now we have 11 of the 19. So I recall when we first brought up this discussion in year one, there was a comment and concern about capacity. And so strategically already, this board has been supporting the build of capacity. So community colleges already have the infrastructure, they already have the support, in terms of accreditation now to apply and move through to an entry into practice bachelor's degree. So that is not an obstacle. Yes, there's a heavy lift, I've got that, but it's not an obstacle that that has to be moved through. The second piece is, well, those aren't the only programs that train and graduate students. We also have private programs as well. And what I could tell from those private programs, I think we have 3 or 4. 2 are already granting degree completion bachelor's degrees, which means they've gone through the process. And I know for private colleges, they have to, all they need to do is just request and go through the process to be a bachelor's degree granting institution. So I just wanted to bring that to light. While yes, there's still a heavy lift, that obstacle really has and is currently being worked through. So all programs that currently offer an associate degree have a process to transition to a bachelor's degree. So from an educational standpoint, we have the infrastructure, and that is great, okay? Probably the biggest question is about how fast, what are we gonna do? How are we gonna notify people? How can we ensure? So the last bullet point that was identified was having a reasonable and comprehensive plan and timeline. That still would need to be worked out. So even if the board says, yes, we think it's a great idea, let's move forward, that would be the next step of certainly the Professional Qualifications Committee to then start working on that and bringing that back to the board, okay? All right. That's the report. I'll turn it over to Michael just to see, Michael, if you have any salient points that I didn't bring up that you want to share.
Well, the only thing that I would add is this is an idea whose time has come. We've been at this for many, many years. It's not just the effort here in California. This started back in 2006 and 2008 with the AARC. And the reasons for doing it were apparent then, and they're just as apparent now. And what speaks volumes to me is the recognition here in California of the managers and the educators and the leadership of the field coming out and endorsing this.
And I do want to bring up just one more point. And so this is not anything new that the Respiratory Care Board has tackled. In the year 2000, the minimum requirements went from a certificate of completion to an associate degree. So there is already a pathway and a process that can be modified to move forward in this perspective. And the executive office in our processes culled all of that information. So that's one of the processes that we take and incorporate. So I turn it back over to President Guzman.
Thank you, Ray and Michael, for your work on this on all these years, for that excellent presentation. We can at this point entertain a motion.
And really, there is no motion yet. It's really a discussion item. There could be a motion out of it, but what I might suggest is just open it up for the board for discussion and then the audience for discussion.
Any members won't have any other questions or comments on this item?
Just, this is Preeti Mehta. I just wanted to thank Michael and Ray for all the hard work. You know, this is no easy feat. I don't know how many man hours have been spent in compiling the information and the surveys and gathering that. So thank you for your hard work.
Yes, for sure.
And to that comment, I would just also like to thank the executive office because they've been involved at every step of the way. They've been engaged. They've been in our committee meetings. The website was, a bit of a heavy lift. Well, just to show it to everybody in the audience. So one of the things out of this, we know that there's a lot of information and lots of people have had different questions. And certainly from my lens, when I've tried to respond, I'm always trying to remember what meeting was that and where is that information? And so the website has been developed and the website itself has been developed in a way of two ways. One is a laundry list of all of the data supporting the discussions and what we did. And then the second, based on a timeline from beginning in June of 2021 to now, so people can look at that information in two ways, just from a laundry list of information to what was the progression and when was that information introduced in the conversation.
Before I open it to public comments, I just want to make sure, are you at this point making a recommendation?
So, yeah, so the subcommittee at this point in time brought a draft recommendation. As I said, it's really a one-liner. It could be more. And so the intention here is if you like what you see and you want to make a recommendation to say, in its essence, we support it. I'd like to make a recommendation with these caveats and feedback. Could be.
Okay, then let's open it up to public comment for those that are here present on this item. Please, come on up.
Can I speak into here?
Yeah, if you could turn on your mic, I think,
And I go.
yeah, there you go. Hi,
Not quite.
Hello, everybody.
there we go.
I'm Naomi Bugayong. I am currently employed at UC Davis Health here in Sacramento. And also I am the secretary at the California Society for Respiratory Care. I wanted to make a comment on my own behalf to thank you guys for expanding our role. I was in the class at Modesto Junior College for the first graduating class for the pilot for the bachelor. And I had a great experience. And so I appreciate your work and being careful that it's measured and studied and with surveys and with data. And I just appreciate you expanding our field because I care about it. That's all.
Thank you.
Thank you very much for your comments. Anyone else? Moderator?
All right, we are open for public comment via WebEx on agenda item 5. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users, dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take just a few more seconds to see if we have a request for public comment. And it looks like our next request comes from Jennifer Tanhill. Hold on just a moment, please. We're sending you a request to unmute your microphone.
Hey, everybody, Jennifer. Hi, Jennifer Tannehill with on behalf of the California Society for Respiratory Care. Just want to thank the board for digging into this and looking at for the new opportunities and staying abreast of where the industry is going and how we can best, serve patients and be working at the top of our game and making sure that respiratory care in California is really the tops and really providing the best to patients and the other providers in the industry. And so just want to thank you guys so much for taking a look at it.
Thank you, Jennifer.
And that appears to be our last request for public comment on this item.
Thank you, moderator. Thanks again, Ray and Michael, for this recommendation. You want to say
Well,
something?
yeah, I would just, as the president, just ask the board if anybody would like to make a recommendation.
Abby?
I would like to make that motion that the Respiratory Care Board expand the educational licensure requirements for entry into practice to a bachelor's degree minimum.
I would like to second that motion. Michael Terry?
So Reza, we need to open it up again for discussion, right?
Since you've already gone to public comment, you technically don't need to.
Okay.
If you'd like, now that there's a motion on the table, you can. I just wanted to add, just to be clear, the way excuse me, the motion was phrased was for the board to expand the educational requirement to a bachelor's degree minimum. I think it's, and correct me if I'm wrong, Abby, that the motion is interpreted to be generally that the board supports the recommendation moving in that direction, knowing that it's going to take probably some legislative change and action outside of this board's direct control.
Yes, thank you.
Do I need to make any language changes then? Motion?
As long as yourself and Michael have the understanding that I just mentioned, I think it's fine.
Okay,
Okay,
we're good.
then we're ready for a roll call?
Mr. Mokpapian,
Yes.
Dr. Meta,
Yes.
Ms. Rosenberg, Mr. Terry,
Yes.
Ms. Williams,
Yes.
Vice President Hernandez,
Aye.
President Guzman.
Yes. Thank you, Katie.
Can I just make one comment just based on that? So with that caveat, and this is for Reza, so would it be appropriate, because there are no details associated with it? Examples would be a time frame, would be some sort of strategy there. I know that some of those are process oriented. But one thing that's not there is it would be by, I'm making this up right now, 2030, which is 5 years away, right? So if we were to massage this with the intention of details and stuff, could we bring it back with rewritten, enhanced?
I think I'm understanding. You could take the motion that was made and then offline, like you said, kind of massage and enhance it and come back with something perhaps more specific. As you said earlier, I think today, if the board members had some more kind of specific concrete direction or details that they wanted to add to this recommendation, they could, or they could leave it as is, and some of that can be fleshed out offline and brought back to the board. Christine mentioned earlier the upcoming sunset review, and that could be an opportunity to make this request to the legislature. Otherwise, outside of that, it would be entire, separate typical process.
And so you've just confirmed, and again, what we've been doing, we've been thoughtful and deliberative. So this isn't going to happen tomorrow. This isn't going to happen in 6 months. And again, just for all of us here at the board and certainly out in the audience to know that we're going to continue this deliberative process to get there. Thank you.
Our goal is to move it forward.
Yes, absolutely.
That's worth just ensuring that we drill down on that. I think most people who are listening have probably been following this for a long time and understand that there's still steps to be taken to
Yes.
implement this. But just in case anyone's kind of casually tuning in or just now tuning in, the board's motion today doesn't effectively implement it. It's going to take some statutory change. And so this is a big step in that direction.
Thank you, Reza.
So I have one more question then. Would it be important to add a timeline because of the sunset review legislation or not?
I was going to mention, as Ray and Michael have stated, we've worked very closely with them, and we do monthly meetings and so forth. And I think we can continue to talk about it, come up with a possible implementation plan, if you will. And if there's agreement, we could go ahead and propose that within the sunset report, which will come back to you for final approval. So that will be part of that process. Hopefully we'll have more details by the time we present it as an issue before the sunset committee.
But I don't need to amend the motion.
No. And again, that's why now was the time to present it, because it gives us time to work through details of this movement forward.
I just had a quick question. Are there any hurdles that we can foresee? I mean, I think this was a big one for us, getting together and passing it. What are the other, like, is there anything else that we can foresee besides a delay and just, administrative, legislative stuff?
I think that the Professional Qualifications Committee, this was an issue that was brought up briefly within the last Sunset Report, and we were able to get some feedback from the legislature. And each of the items that they mentioned, the Professional Qualifications Committee has worked specifically to address, had to do with ensuring that we're not going to have a reduction in the number of practitioners, if you will, during the transition, or is it going to create any additional barriers to licensure and so forth. And I think that they have been very thoughtful in addressing those concerns. That being said, there's also other things, political climate, budget issues, things along those lines, despite us being a special fund. So we will present it, and then hopefully it can go as written, but if not, and we get additional feedback, we will address that at that time.
And just to add, on page 3 of the summary, Christine was talking about in our last Sunset Review, the legislators' feedback. It is there in summary as well. And we've been very intentional to review those and incorporate those into these discussions. So again, being proactive to this process as opposed to reactive, although, when it gets to the fan, we'll be hearing lots of feedback at the fan. We know that, but we're really trying to be deliberative so that we minimize that.
Thank you.
Thank you, everybody, for that great discussion.
I was just going to mention one other thing, keeping in mind how important the Sunset Review process is. And if there's any chance that there may be pushback and so forth, the committees may actually recommend that we run legislation separate so that it doesn't have a potential negative impact on our sunset. However, we do have a very good relationship with the Senate Business and Professions Committee. And I think that it will definitely get the process started so that even if it doesn't go into our sunset bill, we can try to find another legislative vessel, if you will, to try to accomplish.
Great. Thanks, Christine. Moving on to item number 6, advanced practice respiratory therapist. Christine, will you present item 6A?
Again, your agenda materials include information regarding efforts made by the California Society for Respiratory Care to establish an advanced practice respiratory therapist role in California. I wanted to bring this information to your attention as it has potential to directly impact our board. The materials outline proposed legislation as well as benefits of the APRT, which include the availability of qualified practitioners to improve patient care by providing specialized respiratory services, increasing access in underserved areas, reducing costs, enabling timely interventions, educating patients, enhancing care coordination, and driving innovation in respiratory therapy. I'd like the board's input on including the APRT as what we would call a new issue within our upcoming Sunset Report to show the correlation between how the establishment of this role aligns with the board's consumer protection mandate. And I know that Michael has some additional information to offer that I think kind of supports that. So we move on to the next item.
Okay. Anyone from CSRC here to comment on that? Wasn't certain if anyone was prepared to do that. So I did make a little bit of a summary as
Michael, Jennifer Tannenhill just raised her hand out in the virtual audience.
Oh, I'm sorry, I didn't see that.
Moderator?
Just a moment, please. Go ahead, Jennifer.
Thanks for calling on me. I just want to, on behalf of CSRC, thank the board for considering support for this proposal to create the APRT. I think it'd be really helpful to have the board's support and include this issue in the Sunset Review report. So the legislature has it to consider when they're talking about the board generally during Sunset Review and how it's functioning, and also when it's having a spotlight on the industry. CSRC believes cardiopulmonary patients and physicians will greatly benefit by having a graduate level advanced practice provider who comes to the position with already having a strong cardiopulmonary base of understanding. And that's unlike any other advanced practice provider that's out there. So CSRC really looks forward to working with the board on this important issue as it develops and comes up. And we've provided some information and background to the board that should be in your packet, and look forward to working with you all and available for questions.
Thank you, Jennifer.
What I'd like to say is this is another one of the examples of an idea that, comes from the grassroots of respiratory care to address the needs that we see in the medical community, not just the needs now, but the needs in the future. And we know that there's going to be access issues coming in the future for our patients. And I think that developing the APRT will help ameliorate some of the problems that we're going to have in the future by making more practitioners available to our patients that need them. Okay. This is a national movement that's happening in many other states as well. I just was apprised of 5 other states that are in the process of developing APRT language. And so we're one of the first 5 in the nation. Okay. And I would support the idea or make the recommendation that we support the development of advanced practice respiratory therapy as a license in California, and that we should work closely with CSRC to develop the appropriate legislative language. And I was pleased to see in their packet, they have already gone far down that line for getting appropriate legislative language.
Thank you, Michael. Christine, are you seeking a motion?
Here we go. So the recommendation would be to support the development of an advanced practice respiratory therapist license in California, as Michael mentioned, and to work with the California Society for Respiratory Care. I just wanted to add the caveat that in supporting the development of the advanced practice role, we need to be mindful of the consumer protection enhancement portion of it. Basically ensuring access to highly skilled respiratory care professionals, as you mentioned, with the physician shortages and so forth, that this will allow availability and access to those that need pulmonary and cardiopulmonary assistance. And also in collaborating with the CSRC regarding the draft language to prioritize public safety that aligns with the standards of the Practice Act. So I think the motion probably is very similar to 6B if someone's item 6B on the agenda.
Would somebody like to make a motion?
Yes, I'll make a motion. I make a motion to support the development of the advanced practice respiratory therapist role in California to enhance consumer protection by ensuring access to highly skilled respiratory care professionals, and to collaborate with the California Society for Respiratory Care to draft legislative language that prioritizes public safety and aligns with the standards of the Respiratory Care Act following the, what was the Consumer Protections Act? What did you call it?
Respiratory Care Practice Act, but with public protection being the board's priority.
With protection being the board's priority.
I will second that.
Any comments or questions from the members?
This is Dr. Mehta. I did want to, reiterate that the number of physicians, who are aging out, and a number of cardiologists and pulmonologists is going down. So there will be a shortage, and it needs to be the patients' safety being a priority, I think this role is important. Many respiratory therapists are already, participating in this role, especially in the academic centers. Yeah, I definitely support this, and it's a very timely, a timely proposition.
Thank you, Dr. Mehta.
And synergistically, this motion we just approved for entry into practice bachelor's degree really then nicely aligns with the pathway to advanced practice. So really everything is fitting nicely together in favor of California citizens.
Absolutely. Any other comments or questions? Any comments from the public? Those that are present. Please.
Naomi Bugayong. Probably I don't need to repeat. Thank you for that motion and passing it. I know with the CSRC that Jennifer Tannehill has helped us a lot with the language and the process and supporting us through that, as well as Teresa Cantu as part of the Governmental Affairs Committee has worked a lot toward this. And with the Professional Advancement Committee, Crystal Craddock has done a lot of work toward this. And I'm really impressed by the packet that was submitted, and it's very detailed, and I hope it shows our dedication to collaborating toward that goal, the shared goal. Thank you.
Thank you, Naomi. Moderator?
All right, we are accepting public comment via WebEx. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand, and we will call on people in the order we have requests. And it looks like our first request is coming from Michael Herzog. Hold on just a moment. We're sending you a request to unmute your microphone.
Thank you so much. This is Michelle Herzog, Executive Director, Respiratory Care and some associated therapies over at UC Davis Medical Center. What a time to be a respiratory therapist. I appreciate the board so much. Very exciting meeting. I just wanted to say, as an employer, the APRT really gives me a functional way to advocate for career path development, specifically as it pertains to some of our value-based initiatives. And this really is going to enhance employee satisfaction, support career longevity for respiratory therapy. And while we know that there will be some emerging space for advanced practice RT, I can tell you now, there are spaces now that really could use an APRT. We work with many specialties in the critical care spaces at UC Davis, where we currently have an advanced practice provider, but it is not a respiratory therapist. And as was mentioned before, in the areas of cardiopulmonary disease and airway specialties being needed, there's absolutely space for us here and now. And I'm very excited to see where we can grow from here. Thank you so much.
Thank you for your comments, Michelle.
And my apologies about the name Michelle. Next, we have Michael Madison, and I mean Michael this time. Hold on just a moment, please.
Okay, thank you. I just would like to point of information, the National Board for Respiratory Care met last week. A task force met to start developing the requirements for a national credential for APRT, similar to the RRT and specialty credentials. This would be an APRT credential that would fall under the auspices of the National Board for Respiratory Care. And so I'd like to suggest that you add the NBRC to your list of organizations to collaborate with to get this effort rolling.
Thank you, Michael.
Next and potentially last is Crystal Craddock. Hold on just a moment, please. We're sending you a request to unmute your microphone.
All right, thank you so much to the board for considering this. I'm Crystal Craddock. I'm the CSRC president. as well as a respiratory therapist at UC Davis Health. I know you've heard from a lot of us today now, but I am one of those practitioners who works in the outpatient space with physicians and have seen firsthand with the backlog of patients trying to get in to seek outpatient care in the subspecialty clinics we have here in COPD, asthma. Currently, we're scheduled out for follow-ups into December and January, and so an APRT would be very helpful in our urban community as well as in the rural communities. Up north, we have only a handful of pulmonologists, and so we get a lot coming down here to seek medical treatment, and having an APRT positioned in all areas of California can be very helpful. And I really appreciate the board supporting the CSRC on this movement. Thank you.
Thank you, Crystal, for your comments.
And that indeed was our last request for public comment via WebEx.
Excellent. Katie, roll call.
Mr. Markpopian,
Yes.
Dr. Mehta, Ms. Rosenberg, Mr. Terry,
Yes.
Ms. Williams,
Yes.
Vice President Hernandez,
Aye.
President Guzman.
Yes. Thank you, Katie. We're moving on to item 7. This is an update and discussion regarding proposed regulations related to home and community-based respiratory tasks and services and training requirements. I will now turn it over to Katie for an update on agenda item 7.
Thank you. So these regulations were meant to lay out the specific conditions where LVNs can provide certain respiratory care tasks above the basic ones when they're working in home health agencies or in home and community-based settings. So the proposal focuses on 3 things. It's clearly defining which tasks they can perform, setting the standards for the employer-provided patient-specific training, and laying out the guidelines for the demonstrated limited competency certification. We first brought this to the board in March as a draft for discussion. Since then, we've met with the CSRC and camps, and we've made updates based on the feedback we received, and that revised language is in the packet today. Right now, everything is still in the conceptual phase, so we're really looking for feedback and ideas from both board members and stakeholders. We're also planning a dedicated stakeholder meeting in the coming months, so if anyone is interested in joining that, please let us know. That said, we'd love to open it up for board members' thoughts, questions, or concerns about the conceptual language. And for stakeholders, we're also looking forward to hearing your input during public comment. We do know that time is limited, so if you want to give more detailed feedback, please email us. We would love to get your input while it's still in the conceptual phase.
Thank you, Katie. Members, comments, questions?
The only comment I'd make is, again, thoughtful and deliberative process, and bringing things back over and over just certainly makes me feel confident that we're moving in the right direction and ensuring the process is well thought.
Thank you, Ray.
I wanted to add that, as Katie mentioned, we've met with the CSRC independently, and also we did a group meeting with camps just to determine if there could be any crossover as far as the training, providing the training and the demonstrated competencies. From that point, we have continued our work with CSRC camps. There was a little resistance there, and I don't know if it wasn't exactly what they possibly had in mind. They talked about being interested in some changes, but as we explained at that time, the regulations are based on the law that's in effect now, and some of their ideas would require changes to the law, to which, we did explain. If you think that that's worthwhile, absolutely, you could seek an amendment as far as that goes. I think it was actually kind of left off that camps was not 100% sure that they're going to participate in this process. That being said, CSRC has been phenomenal. They've been on board, they've met with us, and so I still feel very confident that we will be able to implement the regulations regardless.
Great.
And we hope that camps does come back to the table and, we haven't cut off communications, if you will. It's just they were looking at whether or not it was something that was going to work for them and then reach back out to us. So
Okay, very good. Okay, let's move on to public comments from anyone in the audience. Please.
I guess I can do it. Let me just.
I have another thankful comment to the board for working so hard and diligently, meeting with the CSRC, with working with the language, and it can feel really nuanced, and so I just really appreciate the interactions, the meetings, the editing, and I want to comment that we are just as dedicated to this as you guys are, and looking forward to instilling some confidence in LVNs performing this care. I really feel like they're our allies for these patients who would prefer to live in these smaller home community-based centers closer to home. And I think that that's where really the spirit of this is. And so I look forward to working with the stakeholders when we develop a curriculum to support the LVNs in a way to expand their confidence and their role with patients in these communities. And so thank you for the interactions and the allowing us to participate. And we look forward to seeing how this rolls out come January 2028. Thank you.
Thank you for your comments. Moderator?
We are open for public comment via WebEx on agenda item 7. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take just a few seconds now to see if we have a request for public comment. Seeing no request for public comment, do you wish to continue?
Yes, thank you, moderator. Very well. Moving on to item number 8, public comments. Excuse me. On items not on the agenda, please note that the board is unable to take action on any items not listed on the agenda. The only action the board may take is to decide whether to place an item on a future agenda. Is there anyone who would like to make a public comment on anything that is not on the agenda?
President Guzman, I just wanted to invite DP Miller up. She is our new regulations attorney. Well, I guess if you're comfortable coming up, I kind of give a little bit of your history. We previously had Dow, and just recently DP has come on board. We did a initial kickoff meeting, introduction meeting earlier this week, and we are excited to work with her.
Hello.
Thank you, Christine. It's nice to meet everyone. I'm so happy to be able to be here in person. Like Christine said, my name is DP Miller. I'm about 1 month and a few days with DCA right now as a new regs counsel. I'm coming from a primarily private practice background and having done a lot of litigation and then pivoted into regulatory work. So I bring a lens of how to see the holes in the regulations and make sure that we are making things that are going to go through the OAL process and stick. And then the last 2 years, I was in an in-house role at a healthcare company as a legal department of one, so did a little bit of everything in the healthcare space. But I'm very happy to be here, and I can't say enough what a well-run, well-oiled machine this board is, and I'm excited to be working with you guys. Yeah.
Thank you, Demi. Welcome to the team.
Yeah, thanks for having me.
Moderator?
All right, we are open for public comment for items not on the agenda. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take a few seconds now to see if we have a request for public comment. Seeing no request, do you wish to continue with the agenda?
Yes, thank you, moderator. Moving on to item number 9, future agenda items. Members, other than any items already mentioned, do you have any specific items you would like to see on the next agenda?
Should we place an item on our next agenda about the need to flesh out the proposal for the BS minimum? Or at least a discussion of that?
Okay.
You know, I look forward to working with Ray and the Professional Qualifications Committee to look at the how-tos now. And the how-tos are very important, and I think we should definitely continue our discussion with that.
Thank you, Michael. You got that, Katie? You got that? Anyone else? Any others? Okay, seeing none. Any public comments on this item? Moderator?
All right, WebEx is open for public comment on future agenda items. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take just a few more seconds to see if we have a request for public comment. Seeing no requests, you wish to continue?
Yes, please. Thank you. We're item number 10, which would be closed session for any disciplinary cases. I understand we do not have any cases as of right now. And so we can adjourn. This meeting is adjourned.